Well, thank you for joining us this afternoon. Yesterday, our government released Ontario's action plan in response to COVID-19. It's an unprecedented plan for an unprecedented time. A $17 billion plan that will get the resources and supports where they're needed most. $17 billion that will provide relief for people across this province. A $17 billion plan that supports our frontline healthcare workers. And our plan is already in motion. We now have 72 assessment centers up and running across the province. And our emergency investments will add 1,000 new acute care beds and 500 new critical care beds. These investments are absolutely critical to increasing capacity in our healthcare system as we all do our part to flatten the curve, as we all do our part to reduce the burden on our healthcare system and those in the trenches. Our healthcare workers, they're on the front lines. They're the real heroes in this crisis. Heroes like the 3,000 nurses who put up their hands to help handle more calls at Telehealth Ontario. Like Kyle and his wife, who are both nurses in St. Catharines, both lending a hand in this crisis. Like Gwen, a personal support worker in Oshawa, who shows up every single day with a smile on her face, ready to provide home care to seniors. Heroes like Yolanda, who is working hard to clean rooms at the inpatient wards at Princess Margaret Cancer Centre. For them, this is not a routine. This is not just a job. This is courage and compassion. This is the Ontario spirit. Their efforts are inspiring. They're always looking out for us, and our government is looking out for them. That's why we're sending an additional $3.3 billion to the front lines of our healthcare system. A targeted response to combat the spread of COVID-19. On top of the $304 million we've already invested to slow the spread of this terrible, terrible virus. Because during these difficult days, we can spare no expense, and I mean no expense. We must spare no expense when it comes to supporting our healthcare workers, when it comes to protecting our families, protecting our seniors. And we will spare no expense when it comes to protecting what we hold most dear. That's why I'm prepared to do whatever it takes to take down COVID-19. And as we look ahead at some rough waters and some dark days before us, we can't lose sight of what matters. We can't lose sight of what unites us as a province, as a people. And I truly believe that our strength, our ingenuity, and our bond to each other will see us through the worst of it and will help us emerge stronger and more united than ever before. It will help us emerge ready to rebuild what we have lost. And I want to thank the people of Ontario and the strength they've shown over this crisis. Thank you, and God bless the great people of Ontario. I'll hand it over to our Minister of Finance, Rod Phillips.
Thank you very much, Premier. Before I begin, I would like to recognize again the amazing work of our healthcare professionals across the province. Doctors and nurses, first responders, long-term care workers, pharmacists, the cleaners in our hospital, the people who are on the front lines. Thank you for that work, and I extend my own deep gratitude for that. Yesterday, I tabled Ontario's action plan, responding to COVID-19 in the legislature. Ontario's action plan is our first step in our government's response to the pandemic that we're now confronting. Although we don't yet know the full impacts of COVID-19 and what they will be, we have committed to ensure the necessary resources are in place to respond to this global emergency. The first steps we announced yesterday include $7 billion in urgent direct funding for healthcare, people, and jobs. The plan also offers $10 billion in cash flow support for people and businesses through tax and other deferrals. Taken together, as the Premier said, Ontario's action plan provides $17 billion of support at this critical time. Our number one priority is and will remain the health and well-being of the people of Ontario. And today I want to reinforce that. Under the leadership of our Health Minister and Deputy Premier, Minister Elliott, our government will allocate $3.3 billion, as the Premier said, to healthcare this year. That's $3.3 billion over what was budgeted last year. Including in that is an urgent $2.1 billion response to COVID-19. Specifically, in response to the COVID-19 outbreak, we will immediately invest $341 million for 1,000 acute care and 500 critical care beds, and over 70 COVID-19 assessment centres, as the Premier mentioned. To help ensure hospital beds are available for those who need them, we're investing $124 million to support 90 transitional care projects, so more than 20,000 patients can move from a hospital bed to a more appropriate care setting, and this will free up vital space in our hospitals. To keep our frontline medical staff safe, we'll spend $75 million to supply personal protective equipment and other medical supplies. For seniors, who we know are particularly vulnerable during this pandemic, we're providing $243 million for surge capacity and virus containment in long-term care homes, as well as around-the-clock screening. Plus, we've added more staff to support sanitation efforts and essential personal protective equipment like masks and gloves. We'll also invest an additional $160 million in increased funding for urgent public health efforts, including virtual care and Telehealth Ontario, to free up space in our hospitals. I know Minister Elliott will speak more about these investments in a moment and how they'll make an impact on the front lines. My promise to our frontline healthcare professionals yesterday was that they would have the necessary resources that they need, and they will. Given the rapidly changing nature of COVID-19, we know our government needs to remain flexible. And so we have set aside a dedicated $1 billion COVID-19 contingency fund to respond to whatever healthcare needs may arise. In addition to this, we have the government's standard $1.3 billion contingency plan and an unprecedented reserve of $2.5 billion, the largest in Ontario's history. COVID-19 poses an extraordinary challenge to the health of Ontario families and individuals and to Ontario's economy. It's the greatest challenge that we've faced in my lifetime. And our historic levels of prudence give us the flexibility to respond to rapidly changing situations. As I said yesterday, every dollar we invest through this action plan that saves a life or saves a job is a dollar well spent. And the people of Ontario can have confidence that we will do whatever it takes to protect their health and well-being. And now I'll turn it over to Minister Elliott. Thank you.
Well, thank you, Premier. Minister Phillips. From the beginning of the outbreak of COVID-19, we have been firm that the health and well-being of our people must be our number one priority. Our government has not hesitated in our efforts to contain the spread of this virus. At the first sign of growing troubles a world away, we mandated the reporting of any suspected or confirmed cases of COVID-19. In doing so, public health units were empowered to take all necessary measures to contain the spread of COVID-19. We have benefited immensely from these early efforts. They have meaningfully delayed the spread of the virus and provided precious time for our province to prepare. Time we have not squandered. Indeed, since these early first steps, we have done everything in our power to contain COVID-19, including enacting a declaration of emergency. These are extraordinary times that demand extraordinary measures. As we confront the growing challenge of COVID-19, Ontario's historic investments will dramatically expand hospital capacity and support the brave heroes working on the front lines of our healthcare system. Our nurses, doctors, paramedics, and personal support workers, each one remaining steadfast in their commitment to keep Ontarians safe. We will do the same for them. We are investing in personal protective equipment and other supplies to protect our frontline healthcare workers. We're providing urgent funding for public health units, hospitals, assessment centers, and long-term care homes to ensure their ongoing readiness to care for an increasing number of patients. including $341 million more for an additional 1,000 acute care and 500 critical care beds. In the face of growing uncertainty and mounting threats, we must work together in common cause. We need every Ontarian to do their part. To anyone who's recently returned home from abroad, you are at high risk of spreading COVID-19. You must self-isolate for 14 days. Do not go to the store. Do not visit friends or family. We are at a critical juncture in our fight against COVID-19. To all Ontarians who can, please stay home. If you must leave, avoid contact with others by keeping at least 2 meters, 6 feet, between yourself and others. We can't stress this enough. Lives depend on it. These are extraordinary times, there's no question. But by supporting our frontline healthcare workers, enabled by our government's historic investments, we will contain the spread of COVID-19 and protect the people of Ontario. Nothing is more important. Thank you.
Okay, we'll go to the phone line for questions. First question.
From Kenneth Jackson at APTN. Please go ahead.
Hi, Premier. You just said you won't spare any expense for our most vulnerable people. So why haven't you placed a moratorium on young people aging out of the child welfare system during this pandemic?
Well, you know something I've said over and over again, we will not spare any expense. We put together a $17 billion package, and when it comes down to it, within our fiscal restraints, within our fiscal capacity, I will not spare a penny to make sure that we support the people of this province. And we're going to continue making sure everyone is supported right across the province. There's a vast amount of needs from everyone, from people that lose their jobs, people that can't put food on their table, companies, small businesses that are hurting. Again, I will not spare a penny. Unlike the federal government, they have the capacity, the financial capacity, a lot larger than all the provinces. I always say they have the printing machine that can print the money. We don't. But I will spend every single penny to make sure we protect the people of this province for the health and the economy of this province. So I will spare no expense.
Follow up. So you'll call a moratorium for these children?
Well, again, we will refer that to people of social services, our minister. Everything's on the table, absolutely everything. And we're reviewing absolutely every single line item there is out there. And there's a tremendous amount of need out there right now. But I just want to be very clear. I've said it over and over again, whatever it takes to help people and within our fiscal restraints, we will make sure that we spend that money.
Next question.
From Travis Benraj at Global News.
Hey, Premier, good afternoon.
Hi, Travis.
So Alberta, Saskatchewan, Quebec, British Columbia, and PEI are all sending residents who lose their jobs or are in self-isolation and unable to work direct payments to supplement what they can apply for from Ottawa. Why is Ontario choosing not to do that?
Well, I had a good call with Premier Kenney last night about that, and we also were able to get the finance minister on that call. But Travis, I'm going to hand that over to the finance minister. That falls under his preview.
Thank you, Premier, and thanks, Travis. Travis, as you know, in the program, we do have a number of direct payments. Of course, the federal government, as a major income transfer program, they announced alterations to that yesterday. The Premier has been lobbying the federal government for those changes. We will be providing, $75 million. That will double the amount that the lowest income seniors, $194,000, will receive. We're also going to be providing $200 for every parent. $200 for children 12 years old and under, $250 for special needs children 20 years old and under, We have gotten rid of time of use, going to the lowest rate of electricity. That'll be a direct support for people. So there are a number of areas where we are supporting, but our objective is to fill in those spaces and the gaps where the federal government is not able to. In particular, in this province, that deals with some of the most vulnerable. So that's why over $50 million to support emergency payments through Ontario Works program, $148 million that's going to go to support people through the various food banks and community organizations. So it's quite a substantial list of supports we're providing. We're providing the emergency child care for 57,000 of our first responders. You know, that is going to be in the neighborhood of $3 million a day for as long as this crisis lasts. So, you know, there is well close to $1 billion of support there that comes directly to individuals, and that's the support that we think makes the most sense right now.
And my follow-up for the Premier. Premier, on April 1st, that's less than a week away, there are tens of thousands of Ontarians worried about making rent. Are you considering a freeze on rent or direct payments to tenants to deal with this?
Well, what I've said, Travis, is if you have a choice between putting food on your table or paying rent, you're putting food on your table. And the government of Ontario will make sure that no one gets evicted. We stand by that, and we're going to make sure we take care of those people. On the other note, please, if you have a job, do not, I repeat, do not take advantage of this. This is for the people that are most in need, that just cannot physically pay rent. But if you have a job, then we expect you to pay rent. This is for the people that just can't afford it. So please, you know, I heard there was a petition going around, just don't pay rent. That's wrong. That's hurting people across the board. We're standing up for the tenants here. So please don't take advantage of it. And if you can't pay rent and you're just in an absolute crisis, then you don't have to pay rent.
Next question.
From Cynthia Mulligan at City News.
That's it. Yeah.
Yes, hello. This is for Health Minister Christine Elliott, please.
Yep.
Minister, I'm hearing from cancer patients that they are having their cancer surgeries postponed, canceled indefinitely. One woman, for example, has breast cancer. She was supposed to have a mastectomy at the end of this month, and she has now been told it's off, it's not happening. She can't even get an ultrasound now. Are we putting current patients at risk? And why are we postponing these surgeries when the surge hasn't even hit yet?
Well, this is a very serious issue, Cynthia, and I'm sure it's very distressing for people who have cancer to have some of their surgeries delayed. But we absolutely need to create capacity in our hospitals to make sure that we will be ready to have a number of patients that need to be admitted with COVID-19. But I would say that these decisions are being made by hospitals, by physicians, in conjunction with the Cancer Care Ontario branch of Ontario Health, based on their particular needs and on the severity of the situation for each person. So these decisions are not being taken lightly. They're being taken based on the evidence, based on the needs of the particular patients, so that we can have that capacity. But we also need to make sure that for those patients who absolutely need surgery right away, they will get it.
Can you give me numbers and what the protocol is between need and what can be postponed? I don't know many people with breast cancer who feel that their surgeries to get it out of their body should be postponed and that would be safe for them. Are we going to lose a lot of current patients as a result?
No, not at all. We are, the decisions are being made by hospitals, by physicians, as I said before, in conjunction with the Cancer Care Ontario branch of Ontario Health. The needs are being determined on an individual basis based on the cancer that the person has and the need for time to, in some cases, for them to have their cancer surgery immediately. For those cases, they will receive the cancer surgery they need, but it's being based on best medical evidence and scientific knowledge here. I know that is not a comfort to people with cancer that are having their surgeries postponed, but those decisions are being made based in consultations with cancer care experts and making sure that people who need immediate surgery will absolutely get it.
Next question.
From Christine Elliott at CP24.
Hi, thank you so much. I'm going to start with Health Minister Christine Elliott. Minister, you have said, even today, there are enough supplies in Ontario for healthcare workers, and we know that more masks have been ordered. We continue to hear from hospitals and nurses specifically that there's rationing of masks taking place. Nurses given a maximum of 2 masks per shift, when normally they would have, let's say, 5 or 6 of these masks over the course of a 12-hour shift. I'm wondering, is the rationing of masks and other supplies an appropriate policy while these workers wait for your ministry to get supplies to them?
There is no rationing of personal protective equipment right now for frontline workers. If they need the masks, they will get the masks. What we have found is that for some of the almost 1 million N95 masks that had expired in terms of use, they can still be used for other purposes. They can be used as surgical masks, they can be used for fit testing, they can be used for other purposes. So we want our frontline workers to be safe. We are working at procurement 24/7. We know that we need to get more supplies. Ontario companies are stepping up in great numbers to help us with protective masks, with test kits, with reagent that we need for testing purposes, surgical gloves, and so on. At all costs, we need our frontline workers to be safe.
I guess what I'm wondering is if there is no rationing of masks, then why have we heard from a number of hospitals that they're only providing a maximum of 2 masks to some nurses during their shifts as on a temporary basis and as a short-term measure? And they say it is, they're focusing on PPE inventory and availability as to why they're doing this. So how else would you describe what they're doing?
I would say that those decisions are being made by hospitals. We are sending them PPE. The hospitals are making the decisions with respect to what their frontline healthcare workers need, but we are continuing to send supplies to them, and we are continuing to procure supplies. I think it's no secret that the supplies are being requested around the world. That's why we are trying to develop our own Made in Ontario supply so that we will have a continuing supply going forward. But as of today, we certainly have the supplies that we need, but it is up to the individual hospitals to deal with the supplies that are being provided to them.
Next question.
From Lisa Jing at CBC. Please go ahead, Lisa.
Hi, can you guys hear me?
Yes.
Premier, as of this morning, the province's numbers show close to 11,000 people in Ontario are still waiting for their COVID test results. And I know you guys have said you're trying to create a capacity to do 5,000 tests a day by Friday, and I know we do have a tech briefing shortly, but I wanted to hear from you. How close are we to reaching that 5,000 a day goal, and what is the concrete plan to get there?
Well, I'll answer what I can, then I'll pass it over to the Minister of Health. We're looking at all resources. We're engaging with the private sector that's going to help out any of the pharma companies that have lab capacities, any universities that have lab capacities, along with our hospitals and along with any of the health sector. We are ramping up, utilizing everyone possible, and that's our number one goal, is to make sure we ramp up the testing. We're having more reagent coming in, so that's positive news. It may be a week or so, but we have more coming in, as the Deputy Premier and Minister of Health said, that there's need for these vital, critical items around the world, and everyone's trying to get at them. And we're going to make sure that we have enough swab kits and reagent to do the testing. We've increased the assessment areas right across this province, and we're going to continue just putting a surge on this every single day. And we are literally on the procurement table around the clock. And I give you one example. I try to give you an example every day, but one of our head procurement folks, he was texting me at midnight last night. I was still in the office, and he's texting. We're going back and forth, and everyone is hands on deck. You know, as I told our procurement department, there's rules when we aren't at war, and there's rules when we're at war. And we're at war right now. So we have to make sure we follow procedures, but no more waiting around, no more taking, you know, days to make a decision. We're making decisions now by minute, hour by hour, to make sure that we expedite anything we need to increase the lab capacity, increase procurement capacity, and all hands on deck. But I'll pass this over to the Minister of Health and Deputy Premier.
Well, as the Premier has indicated, we are taking every step possible to expand the lab capacity, but it has been hindered to some extent by the lack of reagent. We are putting out appeals for reagent across the board. We have some coming in right now, which is great, so that we can increase the lab testing capacity. But I can tell you that the Premier's been working on procurement. I've been working on procurement. We have a whole team at the Ministry of Health that's working on procurement, as well as working with the Ministry of Economic Development. So as the Premier indicated, we are at war against COVID-19, and we will do everything in our power to find the supplies that we need to fight it.
Thanks very much. And a follow-up also for Health Minister Christine Elliott. I just wanted to follow on Christina's question previously about supply. Your government has said more supplies are coming, like masks, etc. But are you guys able to give frontline healthcare workers a specific date as to when exactly that supply is coming in?
Well, we have supplies coming in on a daily basis, depending on what it is that you're speaking about, whether it's masks, hand sanitizer, face shields, gowns, and the other protective equipment that people need. It is coming in. We want our frontline healthcare workers to continue doing the incredible work that they're doing, but we want to keep them safe. We want to keep their families safe, and we want to keep their patients safe as well. So we are providing the protective equipment, and we are continuing every day to reach out to new sources. The people of Ontario and Ontario companies have been coming to us through Ontario Together. They are willing to change their production lines to do whatever we need, and we want to work with them to make sure our frontline workers have everything that they need, not to be worried about protective equipment, to have the supplies that they need to have to continue doing their fabulous work.
Next question.
From Colin DeMello at CTV News.
Hi, Premier. I just wanted to know, so a few minutes ago you had said this, that you will not spare any penny to get the province out of COVID-19.
That's right.
But then you also said that the province will do whatever it takes to help people within our fiscal restraints.
Yep.
Can you give me a sense of what the fiscal restraint is right now, and why does Ontario have any fiscal restraint at a time of crisis?
Well, I should say capacity, not restraint, and if I said that, I apologize. There's certain capacity that the provinces have compared to the federal government. Colin, as my finance minister always reminds me, that we don't have the money printing machine in the basement of Queen's Park, so there's only so much capacity that any province has, and then we have to rely on the federal government. But again, make no mistake about it, we'll spend every single penny to make sure that we take care of the people's health and the economy of this province, because I'm confident when we get through this, and we will get through this, we're the economic engine of Canada. We were leading North America in job creation and economic development before this crisis happened. I have the confidence of the ingenuity of the people and the businesses of this great province to come back stronger than ever, and we will come back stronger than ever. But I won't leave a penny on the table. We're going to work hand in hand with our federal government that has more capacity, much larger capacity than Ontario.
Okay, and just a double-barreled question here. So on booze, if people can now get it from restaurants and the LCBO will deliver it to your home, and you're telling people to stay at home for the foreseeable future, are LCBO retail stores going to remain open, and if so, why? And can you also comment on price gouging with things like Lysol wipes? We've seen the price increase 3, 4, 5 times.
Yeah, so within the Restaurant Association, these folks are hurting so badly. Colin, they're the ones who requested about home delivery, and I think it's a good idea if people don't have to leave their homes. As for the LCBO, I know the Minister of Finance is working hand in hand with Smokey Thomas, and got to give a shout out to Smokey. He's been absolutely incredible. When it comes to price gouging, I have zero tolerance for price gouging. I'm calling them out. Pusateri's, I hear that they're selling hand wipes for $30 a tin. That's disgusting, absolutely disgusting. A company like that would be selling hand wipes for that cost. You know something, I can't even describe the words what I'm about to say, but I'll tell you what we're doing. We're bringing this to Cabinet, and we're going to put an order that is going to be illegal for price gouging. So anyone, when we have so many great companies, vast majority of companies around this province, around this country are trying to help people out, people would have the nerve to actually jack up their prices to $30 a container for hand wipes. It's beyond belief. It's absolutely beyond belief. But a message to anyone who price gouges: we're coming after you. We're going to come after you hard. I'm going to protect the people of this province. And the price gouging, we're going to put this order through Cabinet, and they're done. They're going to be gone. Nothing gets me more furious than someone taking advantage and price gouging the public that are in desperate need of these items. I apologize, Colin, but that hits a nerve when people are being taken advantage of by companies. And again, vast majority, 99%, are taking care of their people, their employees, taking care of volunteering, donating items to people. And then we have bad actors like them. Disgusting.
Next question.
From Laura Stone at Globe and Mail.
Hi there, Premier. Thank you.
Hi, Laura.
I just wondered, you mentioned earlier that you spoke with Premier Kenney about direct payments in provinces. Can you expand on what you two discussed? And regarding the rent issue, I mean, BC has said that they will be sending people up to $500 to pay their rent. Why can't Ontario do something similar?
Well, if you don't mind, Laura, I'm going to pass this over to my financial expert, the Minister of Finance.
Thanks, Laura. So the conversation with Premier Kenney was wide-ranging. It included that. But as I said to Travis's question, we do have many direct supports. Provinces are making different choices about how they're going to provide them. I apologize. I'm going to read from a list. I don't like to do that. I'm pretty good with numbers, but I don't want to get any of them wrong. So, $340 million for parents. That's the cost of the $200 for the children 12 and under. $75 million for low-income seniors. $20 million for OSAP. I forgot to mention that to Travis's question, but that's deferring the interest on OSAP. $26 million directly for Indigenous communities. $52 million that I mentioned through Ontario Works. $100 million additional for skills training. That's for individuals that are affected by COVID-19 and it's affected their livelihood. $148 million, that'll be distributed to shelters through food banks, again, for the most vulnerable. $171 million, that's the cost for 45 days of the time of use decision that we've made to reduce electricity costs, and that began 3 days ago. That's $932 million in terms of the cost there. Add on to that, as I mentioned, the childcare for our essential workers. That's 57,000 people. It's about $3 million a day, as I mentioned, for as long as this lasts. And of course, we don't know how long that'll last. So there's a very significant investment that we've made in making sure that people get direct support. And that's what we think, given the federal government program, again, that was expanded yesterday at the encouragement of the Premier and myself to Minister Morneau. That's the way we think at this point we are best supporting Ontario.
Okay, and just as a follow, Premier Ford, I'm curious about your expectations for teachers. Should teachers now be preparing online courses for students for the next weeks and months as we look to potentially closing schools, maybe even until September? What do you want teachers to do, and should they be now preparing to teach our kids online?
Well, first of all, I want to give a shout out to the great teachers of Ontario. They've always done a great job. I know Minister Lecce, our conversation yesterday, he's going to be rolling out a plan in the next few days. But right now we have, in the interim, we have TV Ontario, and it's on Channel 2, so anyone in the province can get it, and the kids can watch and learn on TVO. But let's see, Laura, let's see how this moves forward, this crisis we're in, the COVID-19, because I will not risk putting the children back in school. It comes down to their health. We always have time in life to learn, but when it comes to health, I will not put them back in jeopardy, in harm's way.
Okay, this will be the last question.
From Lucas Meyer at News Talk 1010.
Lucas?
Please go ahead, Lucas, unmute your line.
Can you hear me?
Yes, we can hear you, Lucas.
Sorry about that, Premier.
That's all right.
I was on mute. Just regarding Colin's question about Pusateri's. We have seen some images in the last couple of weeks about, maybe not as extreme as this one, but other images potentially getting priced up. Why the decision to bring in that legislation now as opposed to a week ago, a week and a half ago?
Well, when we're talking to people, most companies were stepping up and supporting the people of Ontario, and we didn't hear many cases. I understand in some essential services, you might be paying your employees time and a half, double time. I get it. But when you start gouging people, that's unacceptable. And all of a sudden now they're coming up. That I heard that they're out there. And again, it's such a small group of bad actors out there that are doing this. I like just common sense. You run a business. You want that reputation for your company that you're gouging the people in the middle of a crisis like that? It's unacceptable. It's absolutely unacceptable. So we're going to, it's already on the cabinet agenda. We'll have an order moving forward, and we're going to come after them hard, anyone who wants to try to gouge the public. So it's a clear warning. If you plan on gouging, we're going to catch you, and you will be charged.
And like my colleague, a double barrel as my follow. In terms of what you said yesterday about the attempt to flatten the curve by June, July, I mean, is that still the goal in your mind?
Well, I wish, Lucas, I wish, yeah, I'm sorry, my friend. I just wish I had a crystal ball. If everyone follows the chief medical officers of health right across this province, if we follow the protocol, and if we can flatten the curve, because I'll be very frank, we have some rough waters ahead of us over the next few weeks, but if we can flatten the curve over the next couple months, then hopefully make sure that the curve starts going down. I pray every day that happens, but I wish I could have a crystal ball to tell you 100%, but I just can't. And it's even tough for any medical professionals to tell you. But if we do follow the protocols that the Chief Medical Officer of Health has put out there, we have a much better chance. If we just sit back and we don't do anything, we'll be in trouble. But we aren't sitting back. We're doing everything we can on all fronts. Not just the government, but the people are doing it. Again, they're cooperating. I talk to people right across this province, and no matter where they are, as they say, it's like a ghost town. So that tells me people are listening. You have the odd person that may not want to listen. They're putting their families and loved ones in jeopardy. And I think when the people see that, they call them out for it. And good for them for calling people out for not following the instructions of our Chief Medical Officer of Health. I had a good interview, by the way, with Ryan yesterday on 1010. Ryan's an absolute champion.
Okay,
Thank
thank you,
you.
Premier.
Thank you so much, everyone.